Well, we've got a tripledemic of COVID, flu, and respiratory illness, and it's surging nationwide. This perfect storm has doctors' offices packed and hospital beds full. Come winter, the crisis is expected to get even worse.
Well, the rise in demand for cold and flu medications has created a shortage. Medical reporter Lorie Johnson brings us some creative ways to work around the lack of available medicine.
America's healthcare system is definitely feeling the strain of a perfect storm, with 3 viruses hitting all at once. Hospitals and doctors' offices are overwhelmed with flu, COVID, and RSV patients.
Our book-ahead slots absolutely fill up the day before, so we are seeing the surge.
Adding to the problem, some antivirals and other medicines that can treat these and related conditions are becoming hard to find in many places.
We are definitely seeing shortages in some areas of supplies of common antibiotics like amoxicillin, which is the first-line medication for things like otitis media or ear infections, as well as Tamiflu and some other medicines as well.
Nationwide, parents complain about being unable to find children's Tylenol. Its manufacturer, Johnson & Johnson, issued a statement saying while there has been high demand, there is not an overall shortage. If you can't find the medication you're looking for, talk to your doctor about possible substitutions. For example, children's Motrin can sometimes replace children's Tylenol. Then there are home remedies, like the old school fever reducer of a cold cloth on the forehead or back of the neck, where the body gets cooled most easily. Substitutions, however, aren't always available, such as with the current shortage of Adderall, commonly used to treat ADHD, or for the baby formula shortage desperate parents experienced months ago. These pharmaceutical scarcities could be due to an ongoing issue.
It shows that we still have not solved the supply chain problem. You know, this was supposed to be solved 6 to 9 months ago. Remember, Pete Buttigieg, the transportation secretary, was supposed to solve this problem.
A top Biden administration health official says pharmaceutical shortages aren't their fault and have been around a long time.
We have some broader supply chain issues with our medications that we've had for decades. I have seen this as a practicing clinician. I often, when I walk into the hospital, find some normal medicine that I'm used to using not available. We have got to continue working on that. We've made a lot of strides in this administration. But our work here is not done. So we have got to continue making sure that these medicines are available.
So while America struggles with this tripledemic, doctors and consumers will need to be creative in making do with shortages of medications that treat these illnesses and others. Gordon.
All right, Lorie, tell us, why are we seeing such a high number of flu cases? What's causing the early surge?
Well, not only with the flu, but also with RSV. Most medical experts say it's because of the shutdowns that we experienced last winter and the year before. What does that mean? Well, a lot of people did not get the flu and RSV last year and the year before because of the shutdowns. In fact, there were practically no flu and RSV cases the last couple of winters. Why does that impact this year? Well, because when you get these viruses, you develop immunity towards them, or at least some partial immunity. So think about it. All the people that are getting RSV and flu right now, many of them would have gotten it last year or the year before and would be immune or at least partially immune right now.
Well, let's talk about some of the other drugs that are in short supply and what can people do to find medicines that they need?
So we already talked in the piece about amoxicillin, the antibiotic, Tamiflu, children's Tylenol, and also Adderall. So the other ones that are in short supply right now are Augmentin, that's an antibiotic, albuterol, which is often prescribed for asthma. It opens the airways, but it's often prescribed off-label for respiratory viruses. And then a lot of consumers are reporting seeing empty shelves where the cough and cold medications usually are. So what's happening now is doctors are often prescribing a drug, and they're giving their patients another prescription saying, hey, this is the drug I want you to have, but if they're out of it, try to see if they can get this one. And, you know, sometimes these are even exchanges. Sometimes this really works well. The drugs are almost the same. Other times, Sometimes not so much. For example, with Adderall, sometimes doctors are saying, well, if they're out of Adderall, here you can get Ritalin. These are not exactly the same. They're a little bit the same. And so some patients might experience decreased efficacy. Another thing that's happening is pharmacies, sometimes if they're out of a medication, they'll call other nearby pharmacies. And if they have it, they will send the patients over there to the other pharmacy and transfer the prescription. So that's a little bit of a pain, a lot of extra driving, but this is what people are resorting to.
What can we do to boost our immune systems, to protect ourselves? Should we go back to make sure you wash your hands like 20 times a day? I mean,
Yes.
What can we do to prevent actually getting it so we don't need the medication?
Oh, that's a great question. So doctors say the number one thing that we can and should do is get vaccinated. There is no vaccine for RSV, but there is for flu, and also there's the new COVID vaccine, and both are available for people over the age of 6 months. But believe it or not, Gordon, very few people are taking advantage of these. Only about 50% of adults are getting their flu vaccine, even though this year the match is very good. The flu vaccine is very effective this year, as opposed to sometimes it's not. But otherwise, yes, you know all the things, even wearing masks in some cases, and washing the hands. And, one thing to keep in mind is people should know their own vulnerability. So some people are at higher risk than others, and also be careful if you're going to be around people who are vulnerable.
All right. Well, Lorie, thanks for that report.